Welcome to the Passion for Patients podcast. I'm Tonya Winders, your host, and I am so excited to be with you today as we look at updates in environmental allergies. I'm here joined by Dr. Rance, our Chief Medical Officer, and we're going to talk about what's the latest in allergen immunotherapy, in diagnostics, and in treatments across the world. So welcome, Karen.
Thank you so much. I'm looking forward to our discussion.
Yeah, thanks for being back.
Absolutely.
So as we talk about environmental allergies, first of all, what is that? Because people use different terms. What are some of the more common terms like allergic rhinitis, hay fever? What are some of the terms?
Exactly. So environmental allergies are really anything in the environment itself. So it's not a food allergy. It's not something you digest, but something in the air, in the atmosphere, somewhere around your physical home. So things that we think of are like pollen, right? Pollen season, which, can come from grass, come from trees, things along that line. Also an example is Houseless mites, is another example. So the environment, allergies are just that. Outside, not what you take in, but they're outside in your world.
Yeah. And so oftentimes we hear about perennial or year-round allergies versus seasonal allergies.
Yeah.
And again, we know that's different depending on where you live and what part of the world you're in, Northern Hemisphere, Southern Hemisphere. So what are some of the symptoms for these patients?
Yes. So I think, and first too, I didn't touch on the term allergic rhinitis. So when thinking of environmental allergies, allergic rhinitis just really refers to the allergic response, rhinitis being the nose, because obviously the nose is the gateway into our respiratory tract. Now, when it comes to seasonal versus perennial, great point, depends upon where you are in the world, right? And but the seasonal is just that. It comes, it goes, there's a defined ending, a start and an end. Perennial, obviously year round. Now, the term, when we think of seasonal rhinitis, sometimes people, certainly in North America, refer to it as hay fever. It has nothing to do with hay, nor does it have anything to do with the fever. But nonetheless, it's a seasonal onset of nasal symptoms.
And so, what are those symptoms? What
runny nose, sneezing, itchy nose, sometimes the eyes. You can also have allergic conjunctivitis, where the eyes themselves will be itchy, watery, something along that line.
And how common is this? I mean, I've heard numbers upwards of over half the population.
Yeah.
Is that what you see?
Well, typically I would say not quite 50%. I would say probably, depending on the literature, what you're looking at in the area of the world, the age group, somewhere around 25 to 30% or so. And it also depends on, the surveys, if they're asking, have you ever had this issue, or are you currently having this issue? But certainly it is among the 5 most common conditions. Allergic rhinitis is among people worldwide. So it certainly is affecting a host.
A lot of people.
Yes.
Yeah. And so when we think about how environmental allergies are diagnosed, what does that look like in different regions of the world? How are they typically diagnosed?
Right. So the gold standard, if we look at the guidelines, would skin testing, and that has been around for a very long time. Serum testing, taking blood, doing a serum test is also available. The literature is inconclusive about, like which one's better. They both have their benefits depending on, the patient and the circumstances. A newer advancement is diagnostic component testing, where they can get into more specifics, specifically with like Houseless mite or something. We see this advancement also with the food allergy realm, but it is available in the environmental allergy realm. But I will say that certainly in North America, it is not reimbursed by, insurance, et cetera. So we have not seen a large uptake of that methodology yet.
So we now know sort of the way it's diagnosed. It's typically diagnosed in primary care more so than the specialist office, but a lot of times people that have serious allergic rhinitis or unresolved allergic rhinitis or environmental allergies do make it to the allergist, get that testing. So then how do they get treated?
So with the treatment, certainly depends on what they are allergic to. So your first round of treatments would be the antihistamines and then the nasal inhaled corticosteroid sprays. So assuming and a healthy dose of avoidance, right? So for example, if you are allergic to grass, and you've been outside, then before you go to bed at night, you shower, right? Get all of the grass off of you. And so you're doing those practical things like that. Beyond that, there is really what's referred to as a gold standard form of treatment, allergen immunotherapy. So the allergen immunotherapy actually reprograms your immune system to what it was at one point being reactive to, overreacting. It no longer does. And how that's done is you are given very micro doses of the of what you're allergic to, and your body, as I was always explaining it to patients, would build up this army of defense,
Yes.
right? So you're building up the troops, and so in time, then as your dose of which the allergen immunotherapy that you're taking increases, your immune system is stronger.
Yes.
So with the goal, and there's and the outcomes as far as the studies are excellent, as far as the patients who benefit from that.
So several different types of immunotherapy.
Yes.
We know that there are the allergy shots,
Mhm.
the subcutaneous. There are the drops,
Yes.
sublingual drops,
Yes.
and then there are sublingual tablets.
Yes.
So tell us a little bit about those different routes of administration, the different
Right.
way that
Right.
that treatment gets into your body.
Right. So the oldest treatment, as far as the one that's been around for just decades and well, really 100 years, are the allergy shots now.
Yes.
And so they differ in their preparation depending on where you live around the world.
Yeah.
So in Europe, they are specifically designed that for a one type allergen. It is in the injection, and then the patient receives the injection. In the United States, for example, and in Canada, for the most part, we see that the allergy specialist will compound or make a mix of several.
Yes.
So ongoing debate between the two, between the two parts of the world and those philosophies. There's also sublingual tablets,
Mhm.
which are standardized or approved throughout Europe, Australia, parts of Asia, certainly in North America, and they really represent a robust a phase 3 clinical trial aspect.
Yes.
To how they were developed, and safety, efficacy. So
Standardized.
yes.
It's a much more standardized approach. Right?
Yes,
Yeah.
much more. Now, there are also sublingual drops. Sublingual means under the tongue. Now, the sublingual drops, depending where you are in the world, are regulated and and reimbursed, if you will, versus not. So in Europe, there are countries such as France that they do a tremendous amount of allergen immunotherapy drops, and it's how the system it seems to be almost be preferred. Now in the United States, they are off label.
Yes.
And there's really no plan that they would be going through the regulatory process. So truly, when living in North America, if you're looking for an evidence-based dosing, the sublingual tablets would be a route to discuss. Yes,
Yeah.
absolutely.
Um, and thinking about treatment for allergies, one of the first and primary foundational steps we always say is around prevention
Mhm.
and trying to reduce your exposure. So how do we go about educating and really encouraging people to reduce those triggers and prevent the onset of those symptoms?
Right. So I think and that's a broad question, but certainly, it starts with understanding, starting with the end in mind. What are you trying to avoid, right? So for example, houseless mite, which is the most common
Yes.
perennial allergen. If that is a trigger of yours, there are specific things to do. Start in the bedroom. 70% of our time in our homes are spent in the bedroom. Focus on the bedroom. And to the extent it's possible, there are mattress covers, there are, as far as carpeting, yes, and all of that. Now, certainly, and there's also vacuums with HEPA filters, which work. And the evidence is it's encouraging for those avoidance factors, but there's no one's ever said that that's enough in and of itself, right? So there is a balance, but I think certainly approaching that, the pollens, as I mentioned, just don't go to bed with, if you've been outside and you had, pollen is in your air, you can't, maybe in your hair, you can't see it with your naked eye, right? And so, there are trackers. We've talked in other podcasts about how the upscaling of artificial intelligence in our lives is kind of spilling over into our worlds of health and all in a good way, right? So there are a number of apps. I think most of us on our phones, you can get a pollen count, it's high today, etc. So even just being aware, if pollen is a trigger in this case that we're discussing, then that would be a good day to keep the windows closed and the like.
So one of the things we hear most commonly from people is, how can I tell the difference between environmental allergies and a cold? Because the symptoms are pretty close, right? So how do you help people to distinguish between a virus, like a cold or COVID, and allergies?
Right. Yes. So certainly when, the commonality, which it is easy to confuse for many, because they both have primarily nasal symptoms, right? But what we see with a cold or rhinovirus, something like that, 7 days, it'll have a duration. It starts and it stops. And whereas the allergic rhinitis or these environmental allergens, they're going to be more of a pattern that's sustained, right? So now there are some pollens that will be limited to maybe 7 weeks, 8 weeks, so that is limited, but a cold doesn't last that long. So it's really it's an issue of timing, and just to be aware of that. And that's where, back to these apps or some of these other trackable devices, can help you, keep that in mind.
And the other thing that we hear a lot is that it's a lot, this disease really is sort of disrespected, and that a lot of times people feel, oh, it's just allergies. You shouldn't be missing work, or you shouldn't be, missing out on life because it's just allergies. But that's not what we hear. We hear from people that there's a lot of stigma around this, that there's a lot of events that they try to manage the symptoms and condition to keep it from really negatively impacting their events. And that can cause some stress and anxiety.
Absolutely. Absolutely. And there's a lot of literature. There's been research studies that have made evident that having allergic rhinitis increases the risk for sleep disturbance, which then can affect, work productivity, school productivity. Then, and then that can certainly be a part of low self-esteem and mental illness. So, it certainly is all involved.
It's like a domino effect.
It is. It really is a domino effect. But we've also seen, and for those suffering with allergic rhinitis, can relate to just, brain fog, and some of that is certainly from the symptoms. Some of that is just from the medicines you're taking, trying to control the symptoms. So we're back to, really the one form of treatment that is available and is worthy of a discussion for patients to have is the allergen immunotherapy, because that's really looking at, a way of prevention down the road. It won't always be this way necessarily.
And so that's a great question that we often get is, how long do I have to be on immunotherapy for it to actually work?
Yeah. So typically, the guidelines say 3 to 5 years.
Yeah.
And so it's, now if you're doing shots, typically you start off more frequently. And then once you hit a dose where it's referred to as maintenance, but then they are spread out a bit.
Mhm.
But that does require, back and forth to the doctor's office. So
Yes.
factoring that in, because adherence is so important. But also the sublingual tablets that I mentioned that are approved throughout the world. This studies, there's not they haven't done any long-term studies just yet,
Mhm.
but the general guideline is 3 to 5 years, just reflecting the guidelines that were previously established for allergy shots.
Great. That's super helpful. So we've done this in all of the podcasts on these updates. Tell us, what are your 3 tips for those that are living with environmental allergies specifically?
Well, I think the tips are one, let's raise awareness. Let's optimize your awareness. So certainly with air quality, a pollen app, that's assuming it's a seasonal type of thing. But really, checking that, doing what you can to be proactive,
Yes.
right? Because we talked at the very, very beginning that these are pollens that are in the environment in the world. You can't totally avoid them,
Right.
but we're working towards minimizing them. The second is, again, the when it comes to your home, right? And I try to be realistic with patients. That you may have read, or they may read something that says, all right, carpeting's not good. It's not practical necessarily to pull up one's carpeting if one's house has carpeting, just because of the expense. So I tell them to focus on the room, where they are the most, and that way to see, yes. And then we're back to the bedroom, and we talked about that a bit earlier. And then finally, I'm a huge fan of daily saline rinses with the nose. And I personally do it.
Yeah.
And I find it so important because, for example, if you're traveling or you've been in an airplane, the recirculated air, just by constantly cleansing this gateway to your airway, you've lowered the risk that you're going to, certainly aggravate any problem.
Yeah, yeah. So important. So one of the things that we often talk about is just how underserved communities face unique challenges when it comes to different diseases. So in the realm of environmental allergies, what do we see with those underserved communities? How is it different?
Well, I think the primary difference is the limited access to medication.
Yeah.
Some countries have asthma educators, asthma nurses. They have a vocation specifically designed for this, and some areas of the world don't.
Yeah.
So, we talk about medications and treatments, and what does this look like? And again, it comes back to access. So I think that's primarily, the biggest disparity. But at GAP, we're working very hard from a policy and a advocacy standpoint to make changes, right?
Yeah.
To support patients and to improve their access and
Yeah.
education.
Great. So, crystal ball time, let's look forward. One of the big topics in environmental allergies is climate change and the fact that we're having longer, stronger pollen seasons, that people who've never had allergies before
Mhm.
all of a sudden are experiencing symptoms. So, how do you look into your crystal ball and think about what's coming in this realm of environmental
Yeah,
allergies?
yeah, yeah. So it's I think what we're going to see is a greater utilization of these personalized plans, because you're right that with these climate change, we are seeing these longer pollen seasons, and there are individuals who, they may be mid-adult years and they've never dealt with things, and then they moved to a new area and they're, reactive to it. So I think that the mainstays will continue to anchor
Yes.
the treatment. And that is, certainly the antihistamines, the nasal sprays, looking at allergy immunotherapy while prioritizing avoidance.
Yeah. And I know that there are some products that are in like final phase 3
Yes.
of clinical trials
Mhm.
that are new and innovative in allergic rhinitis
Yes.
specifically. So that's exciting because it's been a long time since we've had
It
anything.
is, and a lot of the premise behind the pipeline drugs is, can we make allergen immunotherapy or the desensitization more user friendly, if you will? So, could we stretch out the shots? Could they last longer? And there are a few products that are available along that line in different parts of the world. But I think 2026 holds great promise that we're going to see more, and they'll be longer acting.
Yeah. And I also think that there's some investigation around biologics and the way to perhaps do like rush immunotherapy, do
Yes.
that a more accelerated type of desensitization.
Yes.
So I think it is an exciting time with lots to
Yes.
come on the horizon.
Absolutely, absolutely. I think the rush immunotherapy, again, moving towards a model of more personalized care, that how can we make allergen immunotherapy? How can we shift the immune system quicker,
Yeah.
but safe,
Yeah.
because if we do it too quick, obviously,
Exactly.
it's,
Not
there's
healthy.
issues.
Yes. And risk
Yeah, that's right.
associated. So in our last few minutes, any final messages for patients that are out there living with environmental allergies or providers that are listening in on
Yeah.
the latest around this area?
Well, the message is they're manageable.
Yeah.
Right. And there's lots to do. So, and again, I think we need to really prioritize personalized care, and because it's not a one size fits all, right? So, and then depending on what the patient's goals are, and just to work hand in hand with them. There are shared decision making tools available,
Yes.
which are great. There's also other educational resources that we have on GAP. We plan to expand that as well. So,
Yeah.
so I think all of that is meant to empower the patient. So that's what we're really focused on.
Thanks so much, Karen. Thank
Of
you so much
course.
for bringing that information to us and for giving us the update on all things environmental allergies in 2025. It is a very progressive and exciting time in the field of environmental allergies and an airways disease and atopic diseases. And it's been great to have Dr. Karen Rance with us over the course of these last several podcasts to really help us unpack the science, understand what the best approaches are today to prevention, diagnosis, treatment, and long-term management. So thanks again, Karen, and thanks to you all for tuning in. We hope that until we meet next time, you'll stay passionate.